Hey guys, it's Sean. I decided to make a follow-up video in regards to my appointment with Dr. Maddie. In this video, I'm going to be sharing with you the effects of testosterone, the good and the bad, and the in-between, I guess. This is actually the information that she provided me with on the day of my first appointment in regards to my transition. And if you do go to see Dr. Maddie, it's at the Gay and Lesbian Center. You're going to be watching a DVD that provides the same exact information. So first I'm going to talk about the potential risks of testosterone. I feel like there's definitely a lot more information on the physical, emotional, mental changes, which I will be going over, but I really haven't heard as much about the potential risks. So after time on testosterone, you may experience spotting or bleeding, especially with the missed or altered dose. It is recommended that as long as you have a uterus that you're screened for hyperplasia once every 2 years. It's also recommended that you get a pap smear every 2 years, and the frequency is going to depend on your sexual history. Your ovarian cancer risk may also be slightly increased, which can be difficult to screen for in some cases, and a pelvic examination is recommended every 1 to 2 years to help detect this condition. So yeah, these are some things that's kind of like when you start taking tea, you wish tea would just get rid of that too, but unfortunately it's all a process. Also, a full hysterectomy and bilateral, I don't even know how to say this, but a full hysterectomy, removal of the uterus, ovaries, and fallopian tubes is recommended within the first 5 to 10 years of beginning testosterone. The risk of breast cancer while on testosterone treatment will not be significantly increased, but there really hasn't been enough research on this topic to be certain of the actual risk, so periodic mammograms or other screening procedures are recommended. If you have chest reconstruction surgery and you have your breast removed, a small amount of breast tissue may be left behind, making it breast cancer difficult to screen for. Testosterone is also going to change your health profile to that of a man. So you're going to be at risk for heart disease, diabetes, blood pressure, and high blood pressure, and your cholesterol may also go up. There's no risk of prostate cancer, and there's no need to screen for this condition. Oh, yeah, kind of a given, I guess. Testosterone can also make your blood become too thick, which can increase the risk of stroke and heart attack and other conditions. Testosterone can also cause your liver to work too hard, causing damage. And testosterone levels do not need to be routinely checked, as they are expensive, but may be checked in some cases by request. Some effects of hormone therapy are reversible. If you stop taking them, the degree of which varies. So some things are going to go back, some things won't. And things that aren't reversible are going to be the clitoral growth, facial hair growth, and male pattern baldness. Yeah. So if you do decide, this isn't for me or whatever, you're more than likely going to have to get the hair removal laser treatment or something. And as far as male pattern baldness, I guess Rogaine, I'm not really sure how that works. Bosley. After you've had your ovaries removed, it's important to remain on a low dose of hormones until at least the age of 50 to prevent the weakening of the bones or the onset of osteoporosis. There's next thing is forms of testosterone, and the most common and safe and effective is actually injections, which is normally once a week. Some men choose to start on a lower dose, while others choose to begin at a standard dose. It just depends on how fast you want to see those changes. And transdermal forms are also available, like patches, gels, and creams. But it's recommended that you start on injections first, and then you can later move on to transdermal forms. Also, taking more testosterone is not going to increase the speed of changes. In fact, it can actually create a lot of problems for you, including excess testosterone. can be converted over into estrogen, which can increase the risks of hyperplasia and cancer. It could also make you feel anxious or agitated and can harm your liver and cause your cholesterol or blood count to get really too high. It's also recommended that you take calcium and vitamin supplements, calcium 600 milligrams and vitamin D 800 milligrams. So yeah, those are the potential risks. Now for the actual changes that are going to progress once you start hormone therapy include physical, emotional, sexual, and then there's a little note here about reproductive considerations. So I'm going to go ahead and just skip to the reproductive considerations and then I'll go back. So if you're trying to have kids, this is just something to keep in mind. Testosterone therapy may change the shape of your ovaries and make it more difficult for them to release eggs. Freezing eggs is not yet a realistic alternative for preserving your fertility, not to mention that it is really expensive and it's like a monthly, yearly bill. Your periods may become lighter or arrive later or become shorter in duration. Some notice heavier or long-lasting periods for a few cycles before stopping altogether. And also, testosterone greatly reduces your ability to become pregnant, but it doesn't eliminate the risk of pregnancy. So use birth control if you're with a non-trans man. I've heard of trans men stopping testosterone in order to get the function of their eggs or have kids. But I also know that it's not really known as to, I think there are potential risks in doing that. So those are things that you're just going to have to really talk about with your doctor, I guess. Now for the changes that are going to happen physically. Physical changes, your skin, you're going to notice that within a few weeks. And I don't think any of them are really that great. Your skin's going to become oilier, thicker, your pores could become larger. You may develop acne. Sometimes you're going to develop severe acne. Your your perception of pain and temperature might also differ. The odors are going to change, like your sweat and your urine, and you're probably just going to sweat more overall. Also, the tissue in your chest could also become a little more painful. You might also notice a slight decrease in size, which is great, but they do recommend that you wait 6 months after starting testosterone to have chest reconstruction surgery. As far as your fat distribution, you're going to notice your weight's going to just redistribute around your body, diminishing around your hips and your thighs. The fat under your skin is going to appear thinner, appearing more rougher and with more muscle definition. You're probably going to notice the fat collect in your gut area. That is if you don't really exercise or work out. You could gain or lose weight, and your muscle mass will increase significantly, as well as strength. So those are all really great things. Your face will shift to give a generally more male appearance, and it could take up to 2 years to really see the full effects of that. Bone structure isn't really going to change, like your hips, arms, hands, legs, and feet are probably not going to change. Once you're done with puberty, like your first puberty, your bone growth caps off. So, as far as body hair, beard growth will vary. You might have a lot of hair, you might have very sparse hair, and that could take several years to really see the final result of that. You are also potentially for chest, back, and arm hair could thicken and grow at a faster rate. You might also notice a degree of frontal scalp balding, like a male pattern hairline develop, or in some cases even male pattern baldness, which really sucks. As far as emotional changes go, it could end up being a lot like your first puberty as far as emotional changes, and you might also find a narrow access or range of your emotions. You might have different interests, you might have different tastes, you might behave differently with others. It just depends on your own personal experience. They do recommend that you do some kind of therapy to help you with these changes. Lastly are your sexual changes. You're going to notice a change in your libido. I've only heard of your libido increasing. Your clitoris size is going to begin to grow, typically at a rapid pace, becoming larger when you're aroused. And the forms of pleasure might change too. Your orgasms are probably going to feel different. And they also recommend that you explore and experiment with your new sexuality. So, yeah, long video, a lot of information, but I found it really helpful, and I hope you guys do too. Bye.